Hello friends, welcome to EduSkills OET Made Easy. This is a very different approach to OET learning. I like to tell you how to fall in love with the OET. Are you ready to travel with me? Let's have an experiential learning approach. Let's enjoy the personalized learning approach. We had previous session we had about sentence structure, and as normal, our idea or aim is to make you fall in love with OET. Ultimately, to make learning an experience. And if you're watching on YouTube, kindly consider subscribing and give a thumbs up if you like our work, and do share and animate the bell icon so that you receive all the updates whenever we upload some of the videos for your learning. Yes. So today is writing. Yes, OET 2.0 Occupational English Test Subtest Writing. Now, today we are going to deal with writing skills, specifically based on the sentence structure, which we have dealt with in the previous session. And the next step of it is the grammatical structure or the syntax or this sentence structure to complement the sentence structures we learned previously. If there are some newcomers, don't be perplexed or confused. You will definitely understand when you go through the previous videos what it is. As of now, all of you grab some pen and piece of paper or a notebook in your hand. And I want to tell you, even if you are taking the screenshots, definitely you are welcome to take the screenshots. See that you write down as you listen to, because these are going to be very easy when you write down. And the other side effect or the adverse thing or negative effect of screenshots is that your mind will say, okay, I have taken screenshots, I don't mind. So the mind will not be fully involved in listening. So when you take down notes, you'll be definitely involved because you want to connect point by point. So even if it is rough scribbling, try to take down the notes so that at the end, just looking at your scribbling, your short notes, you are able to construct the whole session back. And if you have some concerns, you'll be able to ask. And if you find any doubt or any problems with any of the slides, please keep it noted, and we will be revisiting after this into that particular slide. And certain presumptions, this is not a beginner session. Definitely beginners can benefit from it, but then we presume that you know what is OET, what are the 4 subsets, why you need to write OET. You are a medical professional or allied health professional. You are interested in having a grade in OET. You love OET and fallen in love with OET. You are present here in the virtual classroom. You love to be here. These are the things we presume. And as usual, I have highlighted A 450 to 500 score. So we'll be aiming at A in our thing. Like a duration, 45 minutes, time for reading case notes 5 minutes, and time for writing the letter 40 minutes. Okay, OET writing assessment criteria. You know that I'll not be explaining. Purpose, content, conciseness and clarity, organization, yana and style and language. These are the 6 assessment segments or criteria on which you will be graded. So yes, and the score allotted to each segment was also dealt with earlier, just to know. Purpose 0 to 3, content 0 to 7, conciseness and clarity 0 to 7, organization 0 to 7, yana and style 0 to 7, language 0 to 7. And to get a grade B, we are not aiming at the B, but then even a minimum, you require 2 out of 3 in purpose and 5 each in all other 5 segments of assessment. And ISBAR, we presume that you know what is ISBAR, and you have gone through the videos, you are perfect on this. And based on that, unless you know what is ISBAR, if you have not gone through the session or practiced through the video, you may not understand a couple of things today. Okay, so use of tense. It's going to be, I'm going to make it very easy, simple. The tenses or the grammar required, that was the greatest concern, repeated concern, time and again in the mentor's hour. So looking into the basic grammar required, along with that, some other aspects as well. So use of tense, using present tense, I do, he does, he makes, he comes, third person singular, we'll be dealing with it. Do, make, come, that is present simple. Past simple is did, made, came, he did, he made, he came. Using the present perfect, he has done, he has made, he has come, we have done, we have made, we have come, all those things. And using the present continuous or work, or I usually use as present progressive. He is doing, she is making, and she is coming, all those things. So we'll be going into detail of these things. Okay.
So use present simple tense, and using the present simple is do, may, come examples. So use of present simple tense. Why? To report unchanging facts in your case note. Why do you need to use the present simple tense? Ask present, a simple present tense, whatever you want to say. To report unchanging facts. Information is true in the present and is not subject to change anytime soon. It's not going to change in the near future or immediately. So the purpose of using simple present is to report the unchanging facts that is given in your case note. And where do you use present simple sentence? At the beginning of the letter. Okay, when you report the patient's name, age, and status. This particular part, in the beginning of the letter, you have to use the present simple tense. And next, for example, the patient is 29 years old. She is divorced and has 2 dependent children. This is simple present tense. The patient is allergic to penicillin. This is also simple present tense. So also, this is used to provide the patient's unchanging status and profile. Whatever is unchanging in the present condition of the patient, you use simple present tense to provide patient's unchanging status and profile. You use simple present. And use of simple present tense when something happens on a regular basis, frequently, or happens now, and happens now. Something happens frequently or on a regular basis, and it is happening now. So, for example, Mr. James, the construction sentence should be, Mr. James experiences chest tightness. It is not Mr. James experiences chest tightness. That is a common mistake you make, and it's one of the major, we can call mother mistakes in OET. Subject to verb agreement. When the subject, Mr. James, is third person singular, in the present tense, the word should carry with it S or ES. Okay, that will be explaining. Mr. James experiences chest tightness, which means Mr. James experiences chest tightness on a regular basis. Happens frequently, and now he is still experiencing chest tightness. So that's why we use simple present tense. And use of, for instance, simple sentence versus case notes. For details such as lifestyle choices, the present tense is appropriate. Where do you use in the case note? The present simple tense. Lifestyle choices. When you speak about lifestyle choices, you have to use the present simple tense. For example, despite previous advice, Mr. James is still smoking 20 cigarettes a day. So, despite previous advice, Mr. James is still smoking 20 cigarettes a day. Still, even now, he was smoking, he is smoking. So, we are giving him the details, his lifestyle detail, his habits. Okay. There you have to use present tense. Again, to describe the patient's current social background, B, I have put capital because I am also assuming that you have in place. The background B is given capital because I want to highlight that we presume ISBAR. So to describe the patient's current social background, you have to use simple present tense. Now, if you know ISBAR, you can clearly make down between background. You have to use simple present tense. What tense has to be used? So tense is the crux of communication, I tell you. Tense decides in the impact, the meaning, and what the reader understands about your patient. For example, Mr. James smokes 20 cigarettes and drinks 2 bottles of wine daily. This is a background given, social background. So this is simple present tense. You have to construct sentences from case notes in simple present tense. There is no confusion. It's exactly clear, crystal clear. Use the simple present tense. Okay, Miss Jessica is overweight and has a BMI of 27.8. Mr. John lives in Lake Park with his 70-year-old wife, Mary. So these all are simple present tense. So when you speak about in ISBAR background, social background, you have to use simple present tense. That's why I said you don't require a personal trainer, or once you complete this course, maybe 2 more sessions on writing, you don't require anybody to correct your letter at all. You can make out, because I'm teaching you every sentence structure and where it has to be played, which tends to be used in particular aspect in ISBAR, in particular constructing sentences for particular case notes. Everything will be crystal clear. So write down the things, practice it, and you should be a teacher for yourself. You should be able to assess your own letter. That's the best part of it. That's called experiential learning. Again, I'm going extensively on use of present simple tense. It is also used to describe anything that occurred during hospitalization that is still continuing. Simple present tense is used to describe anything that occurred during hospitalization that is still continuing. When you're writing the letter, still it is continuing. The condition is continuing. Mr. James needs assistance with dressing, toileting, and transferring. See, I have put still within brackets. Mr. James still needs assistance with dressing, toileting, and transferring. So still is optional. Whether you need to write there, you don't write there, it doesn't make any difference in the meaning. So even by writing, you will be penalized. Even if you don't write, still you will not be losing anything. So it's up to you. If you want to fill in the words, definitely you can use. But if you need to write more, you can avoid. Mr. James needs assistance with dressing, toileting, and transferring. Okay, so something that is happened during hospitalization, still it is continuing. So the reader will understand what is assistance to be given to the patient or client you are referring to. Okay, yes. Miss Jessica consumes a low-calorie diet in order to maintain her weight. So she is consuming low-calorie weight. She was consuming, she is consuming, she will be consuming. She has to be provided with that. Hope that is clear to you. Yes, present simple. See, repeated action. Yesterday it happened, now it's happening, tomorrow it will happen. Okay, I eat lunch every day. So present simple timeline is this is present, this is past, this is future. It was there, it is there, it will be there. Repeated action or habits, we say. Okay, Mr. James experiences chest tightness. That he was experiencing, he is experiencing, he will be experiencing. So this particular small sentence tells the reader he has to take care of his chest tightness. He'll have to consider continuing care or whatever, the management of his chest tightness. So the very sentence, the tense tells what is to be done and what is expected of the reader. Okay, now simple super sentence syntax. Past, now, future. I'll be just explaining all the details in simple present tense, in contrast to which you'll be able to understand the other forms as I'm teaching. I may not be explaining every detail over there because it takes a lot of time. And for example, he likes ice cream. Okay, let's see the syntax. He likes ice cream. That is simple present tense, which means he likes you. He liked it in the past. He likes it now. He likes it even in the near future. So he likes ice cream. It's called a subject, verb, object. If you remember the basic sentence structure I taught you, subject, he likes, verb, and ice cream is object. But in all the Indian languages, it is not SVO order, subject, verb, object. It is always subject, object, verb. So it will be transferred. For example, Malayalam, Avanu Madhura Palaharam Ishtama. Avan is subject, Madhura Palaharam is object, Ishtamana is verb. So in Malayalam, SVO is transferred into SOV, the syntax. And in Kannada, Avanige Sihitindi Ishta. Avanige, Avanu, subject, Sihitindi, object, Ishta is like verb. So again, SOV order in Kannada. Or else if you go to Tulu, Ayag Chipetindi Ishta. Ayag subject, Chipetindi object, and Ishta is verb. So you take any language, Tamil, Telugu, Hindi, whatever the Indian languages, the sentence structure is different. That's the main difficulty or challenge that we face in fluency, because we think in our mother tongue, we call it L1 influence, mother tongue influence. We think in Malayalam or Kannada or Tulu or Tamil or Telugu. Then in the process, when you have to speak out, you have to change the structure of the sentence. SOV has to be changed into SVO. He likes ice cream. Otherwise, for example, if you ask some small kids who are just learning English, ask them, avane madura palaharam ishtamanu. If you ask them to translate it into avane he ishtamanu, avane madura palaharam, no sweets, he sweets likes. So in the same order, they will repeat. He sweets likes. Subject, object, verb. But in English, it has to be changed over, and it has to be subject, verb, object. He likes ice cream. So basic syntax, you should be very thorough with. So he is subject, likes verb, ice cream object. Third person singular. He is third person singular. First person is I. First person singular, I, plural, we. Second person singular, you, plural, you. Third person singular, he, she, it. And plural is we, they, all those things. So this is third person singular. That's why we have S with the verb. Like it like becomes likes. So the timeline, as I said, the present tense expresses a habit or often repeated action. Adverse verbs of frequency, such as often, seldom, sometimes, never, etc., is used with this tense. Let's see. He goes to work every day. See here, go, ES is added. Goes to work every day. They always eat lunch together. They eat lunch together. There is no S with the E, T, because it's third person, plural. It's not singular. So what happens? Coming to this area, third person, singular, and verb ES is added. Third person, plural, S is not added to the verb. Yes. And adverbs of frequency. What is adverbs of frequency? There is a scale being used here. Just understand what is scale, you know. Always I have been explaining. Always. That's why I said these are things are 7 Sapta Sutras, 7 principles are required in all the 4 subtests. Even in writing, when you use, you have to be able to, you must be able to use the scale. Adverbs of frequencies, always, often, then coming down sometimes, seldom, and at last, never. So you see the scale coming. Always means not often, often means not sometimes, sometimes it's not, seldom, seldom means not never. So the scale, from the top to bottom, it becomes just contrast, the opposite. So this is the whole process. And simple present tense, as I said, verb will simple present tense, third person singular will go with it with the verb S or ES will be added depending on the verb format. Mr. James experiences chest tightness. She goes. Go becomes goes to work every day. Yes. Now coming to present progressive. I hope present tense is very simple. It's very easy, and it's called simple present, and it's very simple. So use of present progressive, using the present continuous or progressive, whatever call it. So for example, someone is doing, he is making, he is coming. Okay. So the format will be, structure will be as somebody has posted in the Facebook. You have all the form formats over there. Have or has been, and ing form of the verb. Ing form means doing, making, working, swimming. Ing form of the verb. Has or have. And been has to be used. Yes. Now, use of present progressive tense. How do we use? Am, is, are plus ing form. He is walking. I am walking. We are walking. Ing form is here. Means right now he is walking. Right now it's happening. Okay. He is walking. He maybe started walking earlier, but still he is walking. He is continuing his walk. That is present progressive. The action is progressive. And use of present progressive. Past, he started here walking and he is walking now. He continues to walk. That is, she is walking. He is running. She is walking means continues to walk. Yes, use of present progressive. What is the focus when you use it in OET? On the present action without relating it to the past. There is no connection to the past when you use present progressive. Use is referral and used in this referral and discharge letters. Purpose to communicate a piece of information which has occurred recently. Something that has occurred recently in the life of the patient is being communicated using present progressive. And something new that wasn't occurring before, in contrast to the present perfect that wasn't occurring before. So you'll have to include even in the known cases, you know, there'll be new news to the person whom you are communicating to. Though you are sending to the same community center or same rehabilitation center, you have to mention it because it's a new news to the reader. Something new that wasn't occurring before, in contrast to the present perfect, which I'll tell you. Something new that wasn't occurring before, which the medical practitioner will have to respond to or take into account in an active manner. The reader to whom you are writing the letter will have to consider it very seriously and take necessary action. That you need not tell them you have to take necessary action, because when you use present progressive, says the reader's attention is advised here or requested here. The very tense speaks. So using present progressive, for example, in your writing letter, how can you use it? Okay, one example could be the patient's condition is deteriorating, or the patient is refusing to take her medication. Now the skill used is contrast. It wasn't deteriorating earlier, but it is deteriorating now. It was stable, but now it is deteriorating. And patient was taking her or his medication earlier, but now he refuses to take. The skill of contrast is being used here. Communication, what do you want to communicate with this using the present progressive tense? The situation in the present is different from the situation in the past. Very fact you are using a present progressive tense, a sentence, it tells the reader that the situation has changed. There's a contrast, there's a drastic change or a change, mild change or whatever, a change that requires your attention. So without telling them it's important, it tells them you need to put your attention over here. So what does it mean? The patient's condition is deteriorating means in the past, the patient's condition was not deteriorating, but now it is deteriorating. It means, okay, this simple sentence means that. And the patient is refusing to take her medication means in the past, the patient was not refusing to take her medication, but now she is, means refusing to take her medication. So this particular present progressive tense provides some sort of distinction from or potential contrast to a previous situation. The situation now is not same as the previous, maybe when the patient was admitted or earlier. Okay, there is a change. So the progressive tense will tell you there is a change. Please take note of the change and do the necessary or render the necessary service. Okay, disassociation from the past is what makes it unique in its relevance to the present. It doesn't associate to the past, present progressive. There is no connection to the past, or it is a contrast to the past. Hope it is very clear. It's beautiful. The tense is really beautiful. Once you understand that, you know which particular area of the case bar is bar, you have to use which particular tense, then you can easily construct without even thinking what is to be written there, because you know the structure, sentence structure of each tense. Again, use of present progressive tense when describing an event currently happening. Okay, when describing an event currently happening. For example, Mr. James is experiencing chest tightness, experiencing right now, currently experiencing. Now going to use present perfect, the next type of sentence or tense. Okay, using the present perfect, has done, has made, has come. He has done, he has made, he has come. Used in the elements of the using present perfect, used to connect sorry, there is an extra, don't worry. Used to connect a past action or state to the present. Why present perfect is used? As I said, it is a contrast to the previous present progressive. In the present progressive, there is no relation with the past. There is a just contrast. Okay, dissimilarity, disassociation with the past. But here there is a clear relation to the past. Used to connect a past action or state to the present state. Okay, used in the elements of the situation. For example, although the action or state began in the past, they are linked to the present. The situation of the patient or something that happens to the patient started in the past, but it is linked to the present. There is an influence on the present, or it's still having its influence. The intention is to link a past event to the present, or to show its continued relevance to the current moment, whereby the reader will have to take care of it. Okay. So here, do not use a specific time phrase such as 2 weeks ago or yesterday. When you use present perfect tense, I have seen many of your letters, you say in the present perfect when you use time phrases like 2 weeks ago, yesterday or 2 months ago, please don't use it. You can use, I'll tell you what are the time expressions you can use. This is because the intention of the writer is not to communicate this information as a background. This is not communicated as a background. This is relevant now, as on now. Okay, using present perfect. Where to use the present perfect in your OET letter? To present more recent treatment or advice the patient has received. More recent treatment or advice the patient has received, or to present more recent actions or attitudes which have been associated with the patient. To present more recent actions or attitude which have been associated with the patient, looking at the case notes, which are the most recent treatment or medications or advices or actions or attitudes presented in the case note. Those case notes will have to be constructed into present perfect tense. As a result of their relevance to the present, may not carry a specific time marker. Since they are relevant to the present, connected to the present, and related to the present, still the patient is suffering, the time markers, specific time markers will not be used. For example, I have prescribed the patient propranolol to help control his anxiety. I hope I am right in doing that. The patient has responded well to treatment. Okay, he has responded well. I have prescribed, he has responded. Have and has is another challenge many of you face. Even in communication, when you discuss, even otherwise majority, maybe that's the maximum mistakes you make is regarding use of have and has, which I'll be explaining soon. Okay, what is the purpose of using present perfect? To communicate that there has been no change in terms of relevancy from the past to the present in these cases. These aspects has a relevance to the present. So there is no change. Though it was a situation in the past, it is still continuing. That's why we use the present perfect, clearly telling the reader, it's still, the patient is still suffering with certain problems, and you need to consider or take care of the aspect. So that is the purpose. And using present perfect. Clues in the case notes. Time phrases. These are the time phrases you can use. You cannot use since yesterday, since 2 months back. But in the case notes, if you have time phrases for like for and since, there you have to use present perfect. These prepositions can be used to link past and present actions. For and since are the prepositions used to link past and present. And there are also concerns about prepositions, but in prepositions in itself should be a session. So I haven't taken it in detail here. We'll be dealing with it later because it's going to be very, very long. Okay. Yes, so clue in the case notes where you have to use present perfect. If there is something called these prepositions are being used in the case note for and since, you know definitely what is the sentence structure, how we have to construct sentence using present perfect. Okay, example, the patient has received massage therapy for the last 5 months. For the last 5 months. The patient received them in the past and receives them up to now. Till now, he is receiving massage therapy. That's why we use present perfect. Yes. We also use present perfect for details which describe unresolved situations such as improvement or deterioration in the patient's condition. In the case note, if ever you find a word improvement or deterioration in the patient's condition, the sentence structure is definitely present perfect. So you know what tense is to be used and what is the tense structure. And for example, since his last visit, Mr. John's pain levels have reduced from an 8 to a 4. Since his last visit, Mr. John's pain levels have reduced from an 8 to a 4. See, and articles, most of you have a challenge over there. You don't write the articles. And 8 is EIGHT. So, and it's not the what is written there, but how do you sound it or pronounce it is important. And 8 to a 4. 4 is FOUR. So article is 4. So you know how to describe unresolved situation. Since his last visit, Mr. John's pain levels have reduced. Okay. So to describe such situations, you have to use present perfect tense. Again, what else? Where else you can use present perfect. If you correctly take down these things, clearly you practice this, understand this, and if the video is uploaded, watch it 2 or 3 times, construct the sentences accordingly. You will take it very easy through the case notes, and you know what to write where and how to write, what are the sentence structures to be used perfectly well. And this is going to be assessed, is going to be one of the major assessment criteria in your writing. So it's also used, present perfect tense is also used to describe ongoing chronic conditions. So if any chronic condition is mentioned in the case note, immediately you have to use the present perfect tense, and the sentence structure. Chronic conditions in the patient's medical background. When you go to the medical background, what tense is to be used is present perfect. Then you have a chronic condition. For example, Mr. James has had hypertension for 10 years and diabetes since 2000. Hypertension and diabetes, chronic conditions. So you are using has, the present perfect. And has versus have is the issue that you have. We take note of this very seriously. I have, you have. He has, she has, it has. And we have, you have, they have, which means has, H-A-S, has is used only with the third person singular. Third person singular, he, she, it. As I said, the verb carries in the present tense, third person singular verb carries S or ES with the verb. So don't interchange. Don't say you has, we has, or don't say I has, or we has. Don't say he have, she have, it have. That's a common mistake I have seen in your speaking as well as writing. Be mindful of that. So using articles, as I said, an 8, a 4. An MP is right, but a member of parliament. MP means a member of parliament, but when you say MP, the short form, the abbreviation, you have to use he is an MP. Whereas when you use the full form, he is a member of parliament. Because when you say member, m, consonant sound is not vowel sound, it's consonant. So member, a member. Whereas when you see MP, EM, M means EM, so it is vowel sound. That's why you use an. Though the word spelling here M is consonant, the pronunciation, the sound is M, EM. So it is an MP. And university, U, A-E-I-O, you say U is vowel sound or letter that produces gives a vowel sound. But then here, an university, the sound is Y-O-O, university, Y-O-O. So an university is wrong. You cannot write because it begins with U. A university. Okay, that is right. This one, a hotel is right. An hotel is right. A hotel, and hotel. So H could be silent. There are options to you pronounce it both the ways. A hotel, I am pronouncing H, a hotel, which means a hotel. Whereas if I don't pronounce H, if it's silent, and hotel. So both are right. Just to identify that, it is the sound, the pronunciation that counts on articles. And historical monument, a historical monument. An historical monument, right? A historical monument. That is silent in the beginning, first one. H is pronounced in the second one. Both are correct, but the articles will change. Not very simple, very big thing. You need not bother, but then just for an idea. Where I said an 8 when it's using present perfect with the diagnosed. With the diagnosis, when the condition is unstable, you have to use present perfect. Mr. James has been diagnosed with asthma and prescribed an inhaler. He will return to the outpatient clinic next month for a review of the inhaler's effectiveness. So the condition is unstable. In such situations, with the diagnosis, you have to use the present perfect tense. Asthma treatment is still being finalized. In James' case, it's not finalized. If the inhaler doesn't prove effective, then a different treatment will be considered. So it is unstable. Condition is unstable. In such situations, expressing or communicating such diagnosis, you have to use present perfect tense. When the condition will be news to the reader, as I said, even the previous sentence, when the reader already knows the patient, in known case, what you say, and so you are telling them something new. Okay, Mr. James was admitted to hospital 3 days ago. He's been diagnosed with unstable angina and requires your follow-up care. Here, the diagnosis is news to the reader and how they will be involved going forward in the forward ongoing care and management. This is going to influence. Yes, using present perfect again. Okay, use of the present perfect with the diagnosed. When the condition is unstable, I told you already. When the condition will be the news to the leader, and the timeline will be, we are going to the next one. Use of past simple tense. So the perfect is over. Next is past simple tense. See the timeline. This is present, this is future, this is past. So the past simple is used for something that happened in the past, already over, no connection to the present. Action starting and ending, action finishing in the past, no connection to the present. Simple past tense will be used. Action begins in the past, ends in the past. There is no connection to the present. Any situation. So use of past simple tense, useful in your referral and discharge letters to provide background information, ISBAR, background. When you construct sentences as regards the case notes given in the background, as per the ISBAR, you will be using past simple tense to provide, there's a mistake, to provide, there is no provides, provide background information, which has been specifically linked to a past time period. You're giving a background information which is specifically linked to a past time period. It's not related to the present. Example, the patient first presented 2 months ago with a bowel complaint. Now, she displayed symptoms consistent with IBS. Using the past simple for background. Backgrounds, but specifically I have made B highlighted, uppercase, capital, because I refer it to ISBAR, because we are referring to something which occurred in the past. Okay, past simple tense is used for background when we are referring to something which occurred in the past. And close in the case notes, time phrases, where you have to use past simple or simple past tense. So the clues in the case notes are these time phrases. When something is written 2 months ago or last week, the previous month, yesterday, any of such time phrases are used, there you have to use the past simple tense. If you take these things and these notes, what you are taking down now, and read into your case notes, definitely you will understand where to use what and which tense is to be used. As soon as you read the case notes, you know this is going to be in past simple tense. Yes, use of past tense when describing an event in the past. Mr. James experienced chest tightness, experienced in the past. Okay. Earlier we said experiences, that is different. Now it is experienced, already over, experienced in the past. When describing an event in the past which is already resolved, already it is settled, it is healed or recovered, nothing continuing. Okay. For example, Mrs. Catherine gave birth 5 weeks ago. Mrs. Catherine gave birth 5 weeks ago. The baby has arrived and there have been no postnatal complications from the birth. The baby has already arrived and there have been no postnatal complications from the birth. Already the delivery is over, everything is done with. So Mrs. Catherine gave birth 5 weeks ago. It's something that has started in the past and completed in the past. That is past tense, simple past tense. Use of simple past tense with diagnosis. Okay, how do you use? Mrs. Catherine was diagnosed with pneumonia and treated with antibiotics prior to discharge last week. Pneumonia is now resolved. Mrs. Catherine was diagnosed in the past with pneumonia and treated with antibiotics prior to discharge last week. She was diagnosed and treated, started and completed in the past. There is no connection to the present. Then fourth one, when the situation is ongoing but is stable. Okay, even if there is a situation or influence or connection to the present, but if it is stable, diabetes that is well managed with the medication, though it is continuing in the present, still you can use past tense because situation was diagnosed, treated, and it is stable with the medication. Okay. For example, Mrs. Catherine was diagnosed with diabetes in 2018, for which she takes regular medication. Okay, although this patient still has diabetes, the diagnosis is considered a complete event now that the condition is stabilized. Okay, when the condition is stable, you can use simple past tense. Okay, few more examples. Use of past tense. She was commenced on metformin. She was commenced on metformin is right, but there are mistakes you write like this. She commenced with metformin is wrong. She was commenced on metformin is right. She commenced with metformin is wrong. She commenced on metformin is also wrong. Okay, it's not recommended, such expression. Use of past tense. 3 units of packed blood cells was transfused. Okay, this is a long-lasting discussion in many platforms, and there are being strong things taught. 3 units of packed blood cells was transferred. Though packed blood cells is singular, 3, when you add 3 units, it's plural. That's why this cannot be was. 3 units of packed blood cells were transfused is the right expression. Okay, again, use of past tense was case notes. For details such as test results or vital signs, you have to use past tense, which were accurate at the time of the visit. The past tense is appropriate. The test results or the vital signs which were accurate at the time of the visit, the past tense is appropriate. Okay, whenever the test results or vital signs are mentioned in the case notes, be sure that you are supposed to write the sentence in past tense. Okay, example, on examination, the abdomen was tender on palpation. Okay, yes. So let's recap. Use present simple for something which is unchanging, likely to be true for a long time. Example, patient's profile. When you construct sentences on patient's profile, use present simple. And about past simple, for background information, ISBAR B, you have to use a past simple tense. That you know, in the first one is situation, inquiry, or introduction. Use present perfect for information which links the past to the present. Responses to the patient's condition which are consistent with the past, which doesn't have a specific time reference, or use a time reference with for or since. When there is not such a time reference is not used, present perfect has to be used. Information which links the past to the present. There is a connection from the past to the present when you use present perfect. Present continuous for current information which requires a present reaction or response. When you are using present continuous or present progressive, that the past current information which requires a present reaction or response, the reader need to respond to this particular situation. That's why I use this particular sentence, and is likely to be different to the past. Development in the patient's situation which are distinct from or different to the past. It's contrasting to the past situation. There is a difference. Yes, that is done with. Hope I wasn't very fast. You have almost all the tenses required here with a lot of examples. If you need to, and if you want me to revisit any of the slides, you are most welcome to tell me now. If you have any slides that you want me to revisit, I can revisit. Otherwise, I'll stop sharing and discuss.
Yes, sir. Can you share the previous one, the present tense?
Present tense
slides.
Present tense.
First, simple present. Simple present.
Okay. Why you have to use present simple tense? May I know your name? Your name, please. Present. Yes. Use of present tense. Why do you need to use present simple tense? To report unchanging facts. That is, information is true in the present and is not subject to change anytime soon. Means habitual, recurrent activities. At the beginning of the letter, usually you use it at the beginning of the letter when you report the patient's name, age, and status profile, what we call in short. For example, the patient is 29 years old. Okay. Patient maybe 12 months, she'll remain 29 years old. It is not going to change immediately today or tomorrow or yesterday. She is divorced and has 2 dependent children. She is divorced is a fact, and it will continue to be a fact. And 2 dependent children she has, that also will continue to be a fact. In the near future, there will not be a change. The patient is allergic to penicillin. Sorry, the patient is allergic to penicillin is a fact, is recurring. It is going to continue tomorrow also. Even yesterday, if you have found the patient is allergic to penicillin, even today she is allergic, and tomorrow she will be allergic. So it's recurring, report unchanging fact, habitual things. When you speak of something very habitual, it's you are doing, and you will be doing. Next one.
Thank you, Father.
Yeah. When describing an event currently happening, when you want to describe an event that is currently happening, it's happening now. Mr. James is experiencing chest tightness. Okay.
Okay. And
he
slide also, I did not
he is experiencing right now. Currently, he is experiencing. So you are explaining something what is happening now currently. So he is any situation that they are experiencing now, you have to use present progressive. Okay.
And the next slide also, I did not get
this sentence itself tells the reader that you have to take care of this issue. Correct, no? Because it's continuing. Next slide. Using present perfect, you mean?
Yeah.
Present perfect, you mean, or the present progressive?
This one only.
This one. Okay, sorry. Using present perfect, using the present perfect. He has gone, he has made, he has come. The format, you know. See, used in the elements of the situation. For example, although the action or state began in the past, they are linked to the present. The situation, chest tightness maybe began in the past, but it is connected to the present. Still, there is influence of it. Okay, for example, used to connect a past action to state to the present. A past experience or situation or condition of the patient is connected to the present. And you have to use present perfect. For example, the intention is to link a past event to the present to show its continued relevance to the current moment. Even when you are writing the letter, there is an influence of that particular or that particular situation is relevant. It has not lost its relevance. Do not use a specific time phrase such as 2 weeks ago or yesterday. Such specific time phrase, there are many who use with the past present perfect. Never use it. It's a wrong expression. It goes contrary to the tense structure. But you can use for so many years that I already explained to you. This is because the intention of the writer is not to communicate this information as background. When you use present perfect, you are not using giving background information. So you cannot use in the ISBAR B, you cannot use present perfect at all. You may not be using present perfect when you give background information, because background information has nothing to do with the present. Okay. Okay, thank you everybody. Keep rocking. Enjoy the timings, and after the 3 o'clock session, we'll meet again.